and now I'm talking to Shari McDaid, the Director of Mental Health Reform. Shari, how's it going?
Very well, thank you.
Okay, Shari, we're here today to talk largely about the 2017 budget that is being announced tomorrow. Today, as it happens, is World Mental Health Day, though, also. Can you tell me how big a day today is in the mental health reform calendar, and how you celebrate it, please?
Well, World Mental Health Day is really important, I think, for the whole country because it really gives all of us an opportunity to affirm how important we think mental health is within the context of our daily lives. And for us, of course, we're also looking around this time to make sure that the government makes mental health a priority in the budget. I suppose the way we celebrate it is by acknowledging all the good work that our member organizations do. So, we have more than 50 member organizations all working on the ground and providing supports and services and information to people who care about mental health or who have a mental health difficulty themselves or their family members. And so today we know that many of our member organizations will be holding special events, and it's a great way of boosting the awareness across the country around mental health as an issue.
It's a UN Day, is it?
It's an international day, yes, World Mental Health Day.
I talked to your colleague Laura Kelly, who was on maternity leave, I believe. I talked to her before last year's budget, and I talked to her again before the general election. And I spoke to yourself a few months ago at the demonstration outside the Dáil organised by yourself and the Union of Students in Ireland after Leo Varadkar, the then Minister for Health, planned to divert €35 million for mental health services to other areas of the health budget. Can you tell me how you are finding the new Minister for Health, Simon Harris? And can you tell me, if you can give a summary without going into too much depth, maybe not, of what your main aspirations are for tomorrow's budget?
Well, in terms of how we found Minister Harris and the new Minister of State, Helen McEntee, I think we did get a very early indication of their commitment because they reversed the decision to divert €12 million from the development budget for mental health this year. So that was very encouraging because it seemed that they recognized that the mental health services really do need that funding and that there were good ways of spending it this year and it didn't need to be diverted. And so I had met Minister McEntee and on a few occasions, and I'm getting to know her and her concerns. I think she's very concerned about reducing the stigma around mental health, as well as building up the supports for people who need them, including crisis supports. And we've very much been drawing to her attention in the context of the budget, the need to ensure that every community in the country has 24/7 mental health services, and at a minimum that every area has a 7-day-a-week direct access clinic that people can go to if they are concerned that their mental health is significantly deteriorating and they're known to mental health services, as well as having 24/7 telephone support. So we've been asking for that. And we'd like to see in tomorrow's budget that there is a government commitment to ensuring that that's available in every community around the country. I suppose some of the other areas that we think are important in the budget are around ensuring that people can get help much earlier than waiting for a crisis. So seeing that there are a good number of mental health workers in primary care centres around the country. We know that the provision of mental health in primary care is very uneven, and not everywhere has a psychologist on hand, for instance, to be able to assess particularly where families have a difficulty or children have a difficulty. And so we would like to see that built up significantly this year and next year. And we also are looking for the provision of more advocacy support being available to people so that people can get support in knowing where to turn to for mental health services and whether they're having difficulties obtaining the services they need, that they can have the assistance of an advocate in navigating the system. I suppose those are some of the key areas that we've been looking for in next year's budget.
Okay, I've talked to yourself several times about what you would like to see happen. I've gone into a lot of depth with Lara a couple of times talking about it. How much funding do you think is necessary for our mental health services, Shari, in comparison to the funding we have at the moment?
Well, the experts who put together our national mental health policy in 2006 said that if their recommendations were fully implemented, the mental health budget would be about 8.25% of the total health budget. At the moment, it's only at about 6.5%. So there's a gap to be filled there in terms of increasing the expenditure in mental health to even what they would have recommended. And in some of our neighbouring and other jurisdictions, for instance, in the UK, mental health expenditure has gone as high as 13% of the overall health spend. So we can see that it's possible to make a much greater investment. And we know that there are many people around the country who could benefit from mental health support and maybe aren't getting it yet. So yes, I think that's a good indicator.
All right.
I mean, another way of saying that is that it's been costed that at this point, in order to finish completing the recommendations of a vision for change, that it would take 37.5 million a year for a full dole term. So that would be 5 years. So, that's another way of looking at how much is needed.
And with that 37 million, like the last government, I believe, allocated, it was a 30 or 35 million every year. Was that the necessary funding, is there just some more to go? Like,
There's still more to go. So we still need about that much every year for the next 5 years to actually be able to fully implement the mental health policy. And that is all going really towards, the bulk of that money is going towards mental health staff. So it's going to professionals who would be available, clinicians across the range of types of clinical support, to be available in community mental health teams, inpatient units, specialist services for people with disabilities and people with various special needs.
So am I right in saying that the last government between 2011 and 2016 had that commitment, but the current programme for government doesn't?
Well, the current program for government does commit to continuing to implement a vision for change, but it didn't stick a monetary figure against it. So we need together to hold the government to account for fully implementing means giving that commitment to the extra funding each year.
Okay, can you tell me, are there improvements happening in mental health services? I know, for example, that a lot of primary healthcare centres have been built over the last few years and more are going to open over the next few years. But on the other hand, like if the centres don't have the necessary staff, then it would make you wonder why they were built. Is your job and the job of mental health reform very frustrating, or are there improvements in services happening? Like,
We definitely see that we can see progress, and we have to recognize that mental health is coming from a very low starting point because it was neglected for decades. So it's not going to be a quick fix to try and make up all that ground. We did lose about 1,000 staff all at once, really, over the first couple of years of the recession. But since that time, 600 new staff have been appointed. So we've made up some of that, a significant amount of that ground. It's just that we still are far off the levels recommended. We also see other good developments. For instance, there are mental health services that are now located within primary care centres. And so that's a shift from, say, 20 years ago when your mental health service was in a separate clinic somewhere else down the town. Now oftentimes you can go into a primary care centre and you can know that you can have your mental health needs met there if you have specialist mental health needs as well. It's just the staffing is still a bit low compared to what we need to be able to respond, to keep waiting lists down. Child and adolescent mental health services have not kept pace with a big increase in demand for child and adolescent mental health services. So that's where we're getting stuck with. We're not having enough staff to meet the increased demand. But there are definitely some positive developments. And even around the whole approach to mental health care, where we've seen changes in services across the country of working on a more partnership approach with people who use mental health services and working more with families. We are seeing positive signs of that development across the country.
Am I right in saying that on the issue of staff numbers, before the recession there were about 400 more staff? So if you just want to take the staff numbers on their own, are you saying that before the recession, say in 2007 or 8, that there were more staff and the mental health services were actually better, or is it a bit more complicated than that?
I think there is a more complicated picture. There were more staff in the mental health services in 2008 than there are today. That's a fact. But we're also using our mental health staff more appropriately now. In 2008, there were quite a few old psychiatric hospitals that were still open, and virtually almost all of those psychiatric hospitals are now closed. So we can say that we're using staff more appropriately. The problem is that just because you close a psychiatric hospital doesn't mean that the need for support goes away. So we still need staff to provide services to people. We just need those staff more in the community, and different types of staff than we had in the past. More, social workers and occupational therapists and psychologists. Whereas in the past we relied much more heavily on nurses. Now we have other roles to support the nurses and doctors in this service.
Just to come to the end of our interview, Shari, can you tell me in summary what is your message to our listeners, like just in a summary, including any politicians if they're listening, just on tomorrow's budget, and could you tell us what you think is the best way to keep informed in relation to the matter of mental health and mental health services in Ireland, please?
Thanks for asking that, Darren. Well, in terms of the core message for tomorrow, I think that the main thing we need to know is that government responds to what the politicians respond to what their constituents think is a priority. So the more that people contact their TDs and senators, and the more that they make their TDs and senators aware that mental health is important to them, that they want to see good quality mental health services in this country, then the better outcomes we will have in terms of budgets and service provision. They need to understand that it is a priority for us as citizens of this country. And then in terms of how people can become more informed, well, we would very much welcome anyone joining up with mental health reform. We have a Facebook page. We are active on Twitter. We regularly post on Facebook and Twitter, and we also have our website and an e-newsletter, and we try and keep people up to date with our e-newsletter as well. So anyone can go onto our website, mentalhealthreform.ie, and join the newsletter list, and we'll be keeping you up to date with new developments in mental health services in Ireland.
I suppose you've no indication, do you, of what's going to be in the budget as regards mental health services tomorrow, no?
We don't know what's going to be in tomorrow's budget.
No.
We don't think that mental health is off the agenda, but we don't have any confirmation of how much mental health will be reflected in the budget. So we wait and see.
Okay, Shari, thanks very much.
You're welcome.